Welcome back. We have Dr. Preety Desai joining us, and laser implant specialist, of course, a regular on our show and always coming with some great topics to talk about. Today, Preety, it's bad breath. So why are we talking about that? I mean, it's something we've all experienced, right?
I think we have.
Yeah.
We all have food to eat and we have coffee to drink, etc. But April is Dental Health Month, so I thought I'd bring up actually a very commonly discussed topic in my office. People have gum disease, and of course that's an obvious reason for bad breath, but you could have abscesses and sinus infections as well.
Sinus infections?
Yeah.
I wouldn't have thought of that.
Can actually be a cause of bad breath.
Oh.
And the other thing is that we have a lot of nutritional different diets in the office. So as a part of that, the ketogenic diet is actually known to have quite a lot of bad breath. And simply because you're digesting a lot of fat and no carbs, the ketones that you produce as energy, as a byproduct of energy breakdown, is a part of bad halitosis, unfortunately.
Oh, so anyone on that diet might want to take note?
Want to take note, because often we don't recognize these things ourselves, right?
Yeah.
And so just to be aware that if you are following this diet, it would be important to kind of keep on top of this.
Yeah.
And the other thing is, a lot of diabetics, you know, that are late onset diabetes, they also have the inability to produce insulin, so they can't digest carbohydrates, and again produce more fat breakdown. And also, if your diabetes is out of control, then that is also a common reason for bad breath.
Oh, that's good to know. So poor oral hygiene, though, is I mean, that's probably the most common, but it's good to know that, with the exception of that diet that you were talking about, that it's not always really just what you're eating, right? It could be something way more serious, which is why we're talking about this.
Yes.
So you brought some fun little toys, as you like to call them.
Yes, normally I bring some gruesome pictures. I didn't think that was appropriate for Dental Health
I'm not really
Month.
sure what we would show, but I'm sure you'd come up with something weird. No. So yeah, maybe you could tell us a little bit about the oral hygiene part of this.
Yeah, so obviously we want to cater to all sorts of different mouths that exist out there, and a lot of people have crowding or braces or malpositioned teeth, and it's difficult to brush and floss your teeth properly. And flossing has taken a hit and is difficult to do in the last little while. But there's so many different little interproximal brushes that we have here that can fit in between teeth, so you don't have to have, you know, the capability of weaving floss around your mouth.
Which can be frustrating.
Which is
I
very
think we can all attest to that.
Exactly. And there's different products on the market that can cater to any mouth.
Right.
So no excuse. You know, I understand we're busy, all of us.
Yes.
But if you make it easy to get in to certain nooks and crannies, you can keep your breath smelling fresh.
And how many times a day? I mean, what's your recommendation?
You know what, we're all busy. So if you can keep it to twice a day, the most important being right before you go to bed. That is the key. So if you're going to choose one, that'll be it. But in the morning when we wake up, that would be an awesome time as well. So twice a day would be great. And if you find that you've gone out for lunch and, you know, things don't feel as fresh as they are, then you can certainly, you know, top it up for bonus.
Yeah, absolutely. Yeah. Well, you say morning. Isn't there always that saying morning breath, right?
Morning
so
breath.
Maybe you don't want to start your day with that.
That would be fantastic for all your colleagues and family members.
Okay. Is it kind of a something that people say, oh, well, I just have bad breath because I ate this or ate that, but, you know, are they aware? Is the education getting out there?
I think it's getting out there. It's mindfulness of knowing that this could be an issue and you don't recognize it yourself. So that's number one, keeping up with your hygiene. But also there are triggers, right? There are certain medications that are known for bad breath, certain chemotherapeutic drugs, certain nitrates for cardiac patients. Ammonium nitrate has bad breath. Certainly if you're diabetic, you are much more aware of these things. Coffee breath, garlic, all the obvious. But that goes to show you that if there's a chronic bad breath problem that you're dealing with it and you still have it, gastrointestinal issues, Crohn's disease, gastric reflux, and even cancers have bowel obstruction are all indications that can be diagnosed this way. And even some physicians have diagnosed lung cancer because you're breathing it through bad breath.
Well, thank you, Preety. Dr. Desai, yes, thank you for joining us. Information on the bottom of the screen. If you have any comments for Dr. Desai, she can guide you, and be mindful of your breath. That was our topic today. We'll be right back. Stay with us.